Fetal surgeries can be offered for severe congenital anomalies. We have different conditions nowadays that we can treat the babies in utero before they are born. The main objective is to reduce the risks, the obstetrical risks. So that means reduce the chance of opening the uterus. That means that we want to reduce the risk of uterine rupture, contraction, so that those patients, they will be able to have the contraction, they will be able to labor, so they will be able to have vaginal delivery. And our goal is to have those patients delivering close to term. So we hope to improve also the gestation age that they are going to deliver those babies. Usually those patients with the spina bifida, for example, or any congenital anomalies, they are diagnosed by ultrasound. So usually, and we recommend an anatomy scan, fetal anatomy scan, at around 20 weeks. And usually everybody gets that. Everybody gets those exams, that exam. So the obstetrician and the maternal fetal medicine doctor who are seeing those patients, once they diagnose those problems, my recommendation is to refer to a center who has, where we can have a multidisciplinary approach, and then we can evaluate the entire patient. And then we can establish if that patient is or not a candidate for fetal intervention.
I think that us being able to fix this defect through a less invasive approach, through scopes, effectively, should be a reason to come here. Make the referral early. We're in a time window where we restrict our interventions for the fetal surgery for spina bifida to be somewhere between 19 and 26 weeks, but it has to be within that window. So often when the diagnosis is made, it really have to get a lot of steps in the process in place for the surgery to occur. Many team members involved, and the planning really starts rapidly afterwards. So the earlier we know about it, the better.
We have hope that those babies may have a better outcome by doing this procedure. We know that the situation is tough, is difficult, but we are here to help. And then sometimes the fetal surgery is not the best option, but we are here to provide that support to the families. Mayo Clinic is considered unique for this situation, for fetal interventions, basically because of the multidisciplinary approach. So we have in this institution all the conditions to offer the best for the patients, mothers and babies or fetuses. We have maternal fetal medicine doctors, we have OBs, we have obstetricians, we have anesthesiologists, we have cardiologists. And then the communication that we have, and we establish as a multidisciplinary approach, we establish as a group, and we see the patients together.
The culture of Mayo Clinic is collaboration, so you have experts in each of their own disciplines working together. So in this specific scenario, you have a mother who's pregnant with a fetus diagnosed with a neurological condition, and you think about all the different specialists that you need involved. You need a specialist for the mother, you need a specialist for the fetus who has the neurological condition, you need a specialist to provide the anesthesia for the mother, and then someone to provide the anesthesia for the fetus. And then you have to think about who's going to care for the baby overall after the baby's born, and then the long-term needs of the baby. I mean, think about how many fields that you're talking about, and so one provider cannot manage all of this. And I think it's very fitting for Mayo Clinic, who has experts in all these different fields, and encourages the collaboration between all the different caretakers to come together. And there's no solo player here. We're all working together as a team, and I think this is a perfect example of how it works. You know, when you ask why do we enjoy doing fetal surgery, it's the fact that I like interacting with the families. I like interacting with the expectant mother, and when they're faced with the decision about doing this surgery, they could choose the traditional path of having the baby undergoes all these interventions and potentially has a completely different life, or the mother then decides to have the surgery done by Dr. Rowan or myself. And when the mothers then decide, well, if there's a potential benefit to my baby who's not even born yet, and I can do something about it and have surgery done on myself, then hands down, we find that the mothers will say yes. They will make that decision without a question. And I always step back and realize the bravery of the family, the mother, the father, and everybody involved, that they're going to put their lives literally on the line for the outcome of the baby.